So let's talk about antitussive drugs. Antitussive drugs, they either suppress or inhibit coughing. They are typically used to treat dry and non-productive cough. Anyway, dry and non-productive cough both are same. Like antitussive drugs are usually given in the non-productive cough. Non-productive cough, there is no production of mucus when we cough. Okay, so antitussive drugs are given in the dry cough. Dry cough means there is no mucus production when we cough. So dry cough and non-productive cough both are same. There are two type of cough: dry cough and wet cough. In dry cough, mucus is not produced. In wet cough, mucus is produced. Okay, and let's talk about how does these drug work. They either suppress the CNS, particularly they work on the medulla oblongata. Okay, so they either suppress the medulla oblongata so that coughing does not occur, or they can also inhibit the cough receptors in the lungs so that we don't cough. That's the, yeah. So let's read mechanism of action. They suppress cough either by acting directly in the CNS और by inhibiting the cough impulses in the respiratory tract, जैसे कि मैं पहले कहा. तो ये कुछ एग्जांपल्स हैं किसके एंटीटसिव ड्रग के: कोडीन, नोस्कापेन, डेक्स्ट्रोमेथोर्फोन, क्लोरफेनिरामिन, डाइफेनहाइड्रामिन, and these are the some doses. These are the doses of these drugs. यहाँ पर पीओ मतलब है बाय माउथ. So we can give these drugs in case of dry cough. ड्राई कफ मीन्स ड्राई कफ में म्यूकस प्रोड्यूस नहीं होता है. जब हम खांसते हैं या कफिंग करते हैं तब उस केस में हम एंटीटसिव ड्रग देते हैं. एलर्जिक कफ, इसके कुछ एडवर्स इफेक्ट है जैसे कि कॉन्स्टिपेशन, ड्राउजीनेस, ड्राइनेस ऑफ माउथ, एटेक्सिया यानी कि अनकोऑर्डिनेटेड मूवमेंट, रेस्पिरेटरी डिप्रेशन यानी कि शैलो ब्रीदिंग और टू स्लो ब्रीदिंग, एडिक्शन, वर्टिगो, नोजिया एंड हेडेक. We cannot provide these drug in these contraindications. Like suppose somebody is having asthma, we cannot give these drugs in the asthmatic patient. Contraindicated when we are driving, or obstructive airway disease like COPD, convulsive disorders like seizures, respiratory depression. We cannot give these drugs in these conditions. Drug interaction: when we give dextromethorhan along with MAO inhibitors, these are the antidepressant drugs, and when we give these drugs with MAO inhibitors may produce excitation, elevated body temperature and hypotension. Now let's talk about nursing responsibilities. As a nurse, we have to obtain a history of a patient cough, and as a nurse we need to alert for adverse reaction and drug interaction. We have to monitor the patient's hydration level, as well as we need to evaluate the patient family knowledge regarding the drug therapy. As a nurse, we need to tell the patient taking an opioid antitussive to avoid driving and drinking. Opioid drugs like codeine may suppress the CNS, therefore we can have a drowsiness. Okay, so we should not give opioid drugs to the patient who has a profession of driving. Encourage the patient to perform deep breathing exercise. If somebody is having a coughing, we should tell that patient that you should do deep breathing exercise. That was all about antitussive drugs. So in the last, I will tell you one more time. There are two types of cough: productive cough एंड नॉन प्रोडक्टिव कफ। प्रोडक्टिव कफ में म्यूकस निकलता है जब हम खांसते हैं, और नॉन प्रोडक्टिव कफ में म्यूकस नहीं निकलता जब हम खांसते हैं। इसी का दूसरा नाम है प्रोडक्टिव कफ का वेट कफ, वेट कफ, और नॉन प्रोडक्टिव कफ का दूसरा नाम है ड्राई कफ। तो हम एंटीटसिव ड्रग देते हैं किसमें, ड्राई कफ में, यानी कि नॉन प्रोडक्टिव कफ में, जहाँ पर म्यूकस का प्रोडक्शन नहीं होता, यानी कि नहीं होता खांसते समय, जबकि इसमें म्यूकस का प्रोडक्शन होता है किसमें, वेट कफ में, जो कि प्रोडक्टिव कफ होती है। इसमें म्यूकस का प्रेजेंटेशन देखने को मिलता है हमको जब हम खांसते हैं।